Subscribe to our YouTube channel and press the bell icon to get the latest updates.
The Print off the Cuff, presented by IIFL Wealth and Asset Management, powered by K. Rahija Corp, corporate partner AU Small Finance Bank, in association with global insurance brokers, airline partner SpiceJet.
India is passing through probably the biggest crisis in its history since the partition. And I don't say that lightly. I'm a child of the 60s. I have seen the decade of wars, food shortages, insurgencies, political discord, a lot of trouble in India. This one, however, is not like any other natural calamity that comes and goes. The tsunami comes and hits you, and then you sort out the debris and the damage. But this is like a constant tsunami, a churning tsunami all the time. And it's still spreading. Now, we keep listening to doctors, clinicians, we listen to politicians. We don't listen to, or we don't hear enough public health specialists, because public health is what comes into play when so many people are involved in so many geographies, not just in one nation, but actually in every nation of the world. So on Off the Cuff today, I have among the foremost public health specialists, scholars in the world, Professor Ashish Kumar Jha, Dean of School of Public Health at Brown University now. Professor Jha, welcome to Off the Cuff. And tell me, looking back at India right now, how concerned are you?
Yeah, so thank you for having me on Off the Cuff. I'm very, very pleased to be here. I am very concerned. It is hard not to be very concerned looking at India. India is, I think, facing the biggest health crisis, certainly of the last 50 years, maybe in its history. It is just an awful situation. And it is not a short-term problem. This is not if we just get through the next few days, next week, it will get better. We are in for a difficult several months ahead, unless we can really get our act together. I think the enormity of what India is facing, the number of people who are getting infected, probably the tens of thousands of people who are dying every day from COVID, is unlike anything I have ever seen. When I lived there, or now being a close observer, we're in very bad shape right now, and we've really got to figure out how to get out of it.
Yeah. When you say, unless we get our act together in the next soon enough, what does getting your act together mean?
Yeah, so there are basically three major things that this pandemic has taught us, right? Which is, one is you have to stop the spread of the virus. Second is you have to take care of people who are sick. And third is you have to vaccinate people so you prevent the next spread, right? We've got to do all three of them in India right now. So taking care of the sick is in some ways the most straightforward. Hard to do, but straightforward. A lot of sick people arriving at hospitals. We need more hospital beds. We need more oxygen. We need more treatments. And we need to stop the junk treatment that is proliferating across India. There are only a few therapies that work, and we've got to get people access to those things. So that's got to be priority number one, taking care of people who are sick. But just as importantly, we've got to stop the spread of this virus, because right now it is spreading at an enormously fast rate, and we have to slow it down and we have to stop it. So how do we do that? We know, Shekhar, exactly how this virus spreads. It spreads when two people are in close proximity, they're not wearing masks, and when they're indoors, that's when most of it happens. You can create that environment outdoors if you have a large gathering, a large rally, any kind of thing. You can also create that spread, but most of it happens indoors. You've got to have universal mask wearing. You've got to get indoor spaces cleared out and not have people getting together. No outdoor large rallies. And another really important part of stopping the spread is wide-scale testing, doing a lot more aggressive, proactive testing. That's how we're going to slow the spread of the virus down. And then the third part is vaccinating people so you protect them so that there are not future waves, or when they start, that people are protected and they don't get COVID.
Yeah. You talked about some therapies in India. You said only some therapies work. Others don't work. You use an expression for therapies going on in India. Just tell me more.
Yeah. So, I part of it is I talk to family, right? And I talk to my family in Bihar and Delhi, and they call me and they say, I have a family member who's sick, and they say, somebody's charging me 1 lakh for ivermectin. Should I pay for it? And the answer is no. You should not even pay 1 rupee for ivermectin. It doesn't work, right? So there is a lot of this kind of stuff that is happening across India where I'm talking to family. So there are treatments that work. So let's talk about what we know about how to treat COVID. This is the full kind of pledge of scientific evidence. Obviously, people who have low oxygen levels need oxygen. That's obvious. In terms of drug therapies, remdesivir is something that works early in the disease. If you are very sick, if your oxygen level is very low, it is unlikely that remdesivir is going to do anything. The main therapy for people who are very, very sick, whose oxygen level is low, is steroids, dexamethasone. That makes an enormous difference, saves lives. All this other stuff that you hear about on an ongoing basis every day, people are using heparin, aspirin, ivermectin, hydroxychloroquine. Just stop. They do more harm than good. They don't work.
Doxycycline, azithromycin, does any of that work?
No evidence that any of that does anything useful. I would not use it. If I got infected, I would not want it. I would not use it for my family.
Because the other things that now also started, I'm sorry to use that expression, the new fashion seems to be CT scan.
I mean, you can do a CT scan. Not really sure what the purpose of it is. If somebody's oxygen level is low, you can bet that if you do a CT scan, you will find things on the CT scan. The CT scan is just simply a test to say, do you have lung involvement from COVID? I can tell you whether somebody has lung involvement by just looking at their oxygen level. If it's low, they have lung involvement. That's what is going on. CT scan is not useful. It will not change your treatment. It will not change whether the person does well or not. So it's fine if you have it and you wanted to get it, but it doesn't do anything useful.
It will cost a lot of money. Plus, you take a lot of radiation that people don't realize.
Yeah, it's relatively useless. Most people don't need a CT scan. This is not, again, the question, why are you getting one? To see if there's lung involvement. I can tell by just checking your oxygen level.
That's right. Now, you said that India has to get things right on these 3 axes. You said mitigation, testing, and vaccination. Is India testing enough?
No. I mean, not even close. But so then the question, of course, people say, well, how do you know? What is enough? Enough is an interesting word because it says enough for what? Enough to identify most of the people who are infected? No. Enough to use as a tool for preventing spread of infections? No. So let me give you why I say these things. WHO recommends that your test positivity rate in the middle of an outbreak should ideally be less than 5%. And if you really are doing a great job, it should be down to like 2 or 3%. India's test positivity is about 20%. So here's how to think about that. A 20% test positivity means every 5 tests you do, you get 1 positive result. WHO's recommendation of 5% means you have to do 20 tests to find 1 positive. What this means is if you're finding a positive every 5 tests, that means you're missing a lot of people out there who are positive. And my best guess is, India right now is having 3.5, 4 lakh cases a day. My best guess is that the true number is about 5 times that, based on the positivity rate, 5, maybe as much as 10 times that, but probably closer to 5. That means that it's closer to, 20 lakhs, not 4 lakhs, in terms of the number of cases that India is generating every day. And it may even be more than that. So we know it's not doing enough testing.
So in that case, effectively, if your estimate is correct, that India's fresh cases every day are about as many, if not more, than the new vaccinations pushed into people's arms.
Yeah. And right now we're on the wrong side of that curve. You want to slow infections way down, obviously try to bump up vaccinations as much as possible. Things are still very much on the wrong track. There is some evidence, maybe a little bit of preliminary evidence, I don't want to get too ahead of myself, that maybe India is peaking in terms of number of cases. The last 3-4 days have been pretty steady, around 4 lakhs, maybe a little less. I think that's largely being driven by Maharashtra finally peaking and starting to turn, which is very thankful. Delhi is starting to look better, though their test positivity is very high. But I always remind my friends here in the United States, India is a big country, and there are a lot of people who have not yet, unfortunately, been hurt by this virus, or fortunately not been hurt yet, but they are still vulnerable.
Yeah.
And so there is large parts of Uttar Pradesh, large parts of Bihar, large parts of West Bengal, which are still very vulnerable, and I can imagine real increases in cases in the weeks ahead. So even if it peaks, it may just stay at a very high level and come down very slowly. It may be months before we get cases all the way.
Yeah, in fact, we are running a story as we talk today on how now, because sufficient time has passed, we can draw a clear link between the various phases of elections polling in West Bengal and the rise of cases. So I think the new government there has to immediately get down to vaccinating.
Yes, vaccinations are going to be absolutely critical. And the two things I would say about it is they're the long-term victory. This is how India is going to eventually get out of this pandemic, is through vaccination. So absolutely critical. In the very short run, in the next 2 to 4 weeks, it will not help that much because it takes a little while for people's immunity to build up from vaccinations. But the bottom line is, in the medium run, over the next couple of months, and in the long run, over the next year, it's all about vaccination. So vaccinations are a central feature of getting out of this pandemic. But over the next month, they're going to not have as much of an impact. Doesn't mean we shouldn't be doing it. We've got to do it now so it'll have an impact a month from now, 6 weeks from now.
Yeah, so we'll come back to the vaccines. Let me go back to mitigation. Now, this crisis of oxygen. I can understand remdesivir because in the first wave, remdesivir came quite late in the first wave, and that too in America first. So by the time remdesivir came to the rest of the world, the wave had gone, particularly in India. Maybe Brazil, it continued. Now, has any other country had such a crisis of oxygen?
No, so we've seen at moments in some Brazilian hospitals, in some Brazilian communities, running out of oxygen. And there was one day in Los Angeles, in the United States, where there was talk that they may start running out of oxygen. But of course, immediately, oxygen supplies were bolstered. But this idea that you have hospitals running out, that you have to have people go get their own canisters, we have not seen this anywhere in the world that I'm aware of. And it is, to me, just shocking to see India in this situation, because India has so much capacity. We saw these infection numbers rising for so long. This is not where India should be. I suppose the one part maybe that's not shocking is, as you know, India has been underinvesting in healthcare and its health infrastructure for a long time, maybe forever. And that means that its capacity was worse in terms of handling this stress than I think many of us expected. But no other country is seeing this kind of widespread drop in oxygen supplies. It's really stunning.
So can this oxygen shortage be mitigated like this, as it's being done by flying in by plane load, even if they are C5 Galaxies?
Yeah, I mean, I think so. I mean, again, India also has plenty of internal production capabilities. And so this is such a massive problem that this is not going to be, America is not going to come to the rescue. That's not how this is going to work. America as a friend will help, and America can help a lot, and UK can help a lot, and other countries can help a lot. But this is going to have to be one where the Indian government's going to have to do a lot of the work of ramping up production, getting it to the right places, making sure that all the hospitals are getting it. This is a very substantial logistical challenge for the Indian government.
Yeah. Now, I presume we take an optimistic view and say that in a week or 10 days, the oxygen crisis, unless the numbers further increase, will perhaps be not the headline. Now, there are people, not public health experts, but people who run lots of medical education and medical institutions, like Dr. Devi Shetty. They say that you guys, before you get out of the oxygen crisis, you will be in a manpower crisis or a human resources crisis, because you'll be short of doctors, short of nurses, short of paramedics, short of technicians, because even if they've been pre-vaccinated and they are not getting infected, they are getting tired now. And they are also going through mental stress, and they just have too much to do.
This is a huge problem. This is something that you can't manufacture quickly, right? You can make more oxygen, you can fly in oxygen from other places. You can fly in a little bit of manpower, human resources, but not at the scale that India needs. And this is probably the thing I worry about most, is the longer this drags on, the harder it will be to just keep these hospitals open and functioning, because of you won't have enough doctors and nurses. This is a bit of problems that we saw in the United States. We had a very large outbreak during the months of November, December, January. And by January, hospitals were having a very hard time. We did not run out of oxygen, didn't run out of medicines, but hospitals were having a very, very hard time keeping their hospital beds staffed with nurses and doctors. Because if you think about it, these doctors come into work every day, they put on their full suit, they're there for 12 hours wearing that suit, they see many people die, and they go home and they do it again and again. And at some point, the human toll of that becomes unmanageable and people need breaks. And of course, we've also seen in places, including India, but elsewhere, that doctors and nurses get infected and they get sick. And that creates fear among other doctors and nurses who say, well, I don't want to put my life at risk here. So it's a very, very complicated situation. And this is one of the reasons we've got to get this infection under control quickly, because I am worried that we're going to run out of people to take care of people, even if we fix the oxygen problem.
So what should India do to mitigate that people challenge?
Well, first and foremost, certainly every healthcare worker should get vaccinated. I mean, that to me is like, and make it very easy. And if there's any concerns, any skepticism, you really have to help people get over that. But getting the healthcare workforce of India vaccinated more or less right away should be one of the top, if not the top, vaccination priority. Because if you lose your workforce, you're gonna have a very, very hard time keeping going. So that's one. Second is, it's hard enough taking care of very sick people. If you are taking care of very sick people and you don't have supplies, you don't have oxygen, you don't have medicines, that becomes that much more stressful. So fix those issues. Make sure that they're well protected. Make sure that doctors and nurses have very high quality masks and protective equipment. That is true in some hospitals, as I am seeing it, but there are other hospitals around the country. Certainly what I'm even hearing from family and friends in Bihar is that doctors and nurses are running out of good quality masks to wear in the hospital. And if you're not going to have a high quality mask, it's going to be very hard to ask somebody to go in and take care of COVID patients all day. So we've got to protect them as much as possible, give them the tools they need, get them vaccinated. And that's your best shot of keeping them going.
Yeah. So have you seen this Government of India plan now to draft final year students and senior medical students and nursing students into the workforce?
No, I have not, but it seems very similar to what happened here in the United States in the middle of the surge, initially last March, April, where we drafted medical students and nursing students into the hospitals and gave them the opportunity to work on the front lines. And I think it worked great. I think they can do it. They need supervision. They're not fully ready yet, but under the supervision of more experienced doctors, it's a very good short-term solution. If you're doing this for a few months to try to get through a crisis, I think it's a pretty reasonable approach to do.
So we are still in the area of mitigation and testing. Now, vaccine you spoke about. First of all, if India has to vaccinate more, now all of us have fretted and fumed and complained and fulminated over the fact that somebody forgot to answer somebody forgot to order more vaccines in time because you have to produce vaccines. So instead of stockpiling, India was waiting, taking price negotiations for too long. Also, letting the export orders be fulfilled. And if export orders were to be fulfilled, which is fine, then orders for more should have been placed early enough. Now, that has not happened. So we are where we are. As we see now, India's capacity at this point of the two Indian manufacturers until July would be about max, about 80 million a month. It's a 2-dose vaccine. So that takes too long. From where does India find the vaccines at this point?
Yeah, this is a very critical question. And I agree that, like, look, there were 3 countries that bet big on vaccines last year: US, UK, and Israel. And they largely have their populations vaccinated. And most countries did not do the same level of aggressiveness. And so that is a difficult situation we find ourselves in. I think the production capability, as I have heard it from both Serum and Bharat Biotech and others, is, I mean, 80 million doses a month, 80 million, even if it's 100 million doses a month, is not anywhere near enough for India, right? India needs, my best estimate is that for India to get to a point where you have enough population immunity to really suppress the virus and avoid a 3rd wave, you probably need to get to about 50% of the population vaccinated. And if you do the math, we're at about 10% of the population now with 1 dose. That's another 40%. That's close to 500 million people need to be vaccinated. And even if you do a 1-dose only strategy, even though these are all 2-dose vaccines for a while, that's going to take 5-6 months to do. And then everybody still needs their 2nd dose. It's a huge problem. So this is one where I think India alone cannot solve it. India, of course, has a lot to contribute to this, but this is where we need a global strategy, because the problem, it turns out, is supply chains, all the raw materials. I have been talking to many of the companies that are involved in producing the raw materials for vaccinations. Their problem, of course, is they've got orders from Brazil, they've got orders from China, they've got orders from Russia, they've got orders from the Europeans. So and of course, they're trying to figure out how to prioritize India given the crisis it's in. We really need, I think if we just let business as usual continue, it will take us well into 2022 before a majority of Indians end up getting vaccinated. That to me is too long. It's a huge problem. So I have actually been arguing and pushing the Biden administration to pull together global manufacturers, to work with governments to say who else has capacity, to figure out not just the main suppliers now, can they make more, but who else can make these supplies who may not be in that business. Maybe there are other companies that have the ability to make some of these raw materials, and maybe we need to recruit them into the business. But we need a very, very different, much more aggressive strategy, because as I look out through the rest of 2021, I am not optimistic that we're going to have anywhere near enough vaccines to prevent a 3rd wave and a 4th wave around the world, not just for India. So we need to come up with a different strategy. Of course, if there are specific raw material needs and issues that Serum, for instance, has, we should, as a global community, figure out how to fulfill that as quickly as possible.
So America has a bunch of vaccines that it's never going to use. AstraZeneca, essentially. What is the hesitation about giving it to the rest of the world? I mean, this could be loaned to a country like India. In the course of time, India can return it.
Completely agree. I have been very, very vocal about this, Shekhar. In the United States, I have a lot of friends in the Biden administration. They're very good people and they're trying to do the right thing. And I've been beating up on them and saying, what are you doing? Why are you holding on to these things? It's time to let these vaccines go. Look, these are very good vaccines. AstraZeneca is obviously the vaccine the UK has used, is the vaccine Europe has used. It is the same vaccine as Covishield, already authorized for use in India. I believe that we should absolutely give away our stockpile. We won't use it, not because we don't want it, but it hasn't even gone through regulatory approval in the United States.
Right.
And we have more than enough vaccines of Moderna, Pfizer, Johnson & Johnson to vaccinate every American. We do not need the AstraZeneca. And I also think in the upcoming weeks, We will not need all of our Moderna and Pfizer and Johnson & Johnson vaccines. I think we should start giving many of those away as well. Of course, they will need regulatory approval in India, but of course, Indian authorities should do that, work with the US FDA, give it authority, give it approval. And India and America should be sending out all of its excess vaccines to India and elsewhere, and countries around the world.
So among the many questions that come up in India is that, oh, look at these Americans and Europeans. They've got the first world vaccines, whereas we've got the third world vaccines.
Yeah, no, I mean, the United Kingdom has vaccinated its people using AstraZeneca, which is Covishield, same vaccine. Much of Europe is vaccinating using AstraZeneca, which is Covishield. So, no, like it's the same vaccine. It's not a third world, first world vaccine. It just has a different name because in India, we have many things with a different name. But it's the same, exactly the same vaccine. And therefore, the way I look at it is I have friends in the UK, and when they called me and said, should I get this? The answer was, of course. I have family in India, and they called me and said, should I get this? The answer is, of course. If I were living in India, I would be delighted to get this. So it's just not available in the United States, so we can't use it here. Or it's not authorized in the United States. It's not allowed to be given in the United States yet. So there is no first world, third world vaccines. The AstraZeneca Covishield vaccines are excellent vaccines.
And Covaxin, the other Bharat Biotech vaccine?
I will be honest with you, I know less about it because the data is not so available. We have a lot of experience and very, very detailed data about Covishield. Covaxin, of course, it was approved before the third phase of the trials were finished. And the data we have seen on Covaxin is just one page. Here it is, overall efficacy. Everything I know about the vaccine makes me think it's a very good vaccine, but they should be releasing a lot more detailed data about their vaccine so that the whole world can look at it and see what it looks like.
Well, I think the problem with Covaxin is there's not just enough of it.
Yeah,
right.
That's the other part of the problem. So it's a combination of both.
So if India were to look around the world, Dr. Fauci spoke to the Indian Express and he said, just try and get vaccines from every vaccine manufacturer in the world. So where do they get these from? If somebody in government of India picked up the phone and said, Dr. Jha, please tell us, where can we buy 500 million vaccines? Yeah.
Right. So the first thing I would say, by the way, and this is
at this point, even if India gets 200 million vaccines, it cushions India over the next 2 months.
Absolutely. So let's be very clear about this. Every additional dose of the vaccine is useful. Whatever India can do on vaccine procurement should be the strategy. And in my mind, the sources of where India can get those extra vaccines, there's certainly additional vaccines available here in the United States, and America should be giving them to India or lending them to India, not just AstraZeneca, but also the others that we have excess supply of. I think that's critical. The Russian vaccine, again, based on all the data we have seen, it appears to be very good. It needs to be reviewed quickly by the Indian authorities. The European Medicine Agency is reviewing it. There are many different companies making the Russian vaccine. And so figuring out how to get, and not just in Russia, but elsewhere, figuring out how to get some of that, I think is critical. The other major supplier right now of vaccines for the world is Sinovac, the Chinese vaccine. And again, the problem with some of these is the transparency isn't there. We don't have the same level of detail of how good it is. The data that I've seen on Sinovac looks like it's pretty good. It's got about a 50-60% efficacy. So maybe not as good as some of the others. But the Russian one, the Sputnik 5, seems quite efficacious, almost 90% efficacy. So it's got, there are a lot of different vaccines out there. India's strategy's got to be in all of the above. But the other thing, by the way, India has to do is more clearly articulate how much extra capacity it has. Because right now, there are a lot of companies in the world who want to help India produce more vaccines. It's not just good for India, of course, because India will ultimately also be the source of vaccinating the world once it starts managing its own population. And so what's been hard for me to sort out here in the United States is there still excess capacity in India for vaccine production? And if there is, Where does that excess capacity reside? And then what do we need to do to turn that excess capacity into more vaccines? And some of that, I think, has to be articulated a bit more clearly by the government.
Yeah. In fact, I saw your comments also in that Politico article on how there was a kind of a split in Biden administration of whether they can spare these vaccines or not, AstraZeneca vaccines or not. Now, there is a third issue. There's that's been not talked about sufficiently. And that is this new folklore over new variant, that what you're dealing with is something entirely new, that everything you learned about COVID doesn't apply to this, so to this son or daughter of COVID, of coronavirus. This is something else. Oh, you don't know, this is a foreign variant. That's why we have so much trouble. So does the wisdom we have learned dealing with COVID so far apply to these variants? What are these variants? How many of them are there? And how different can variants be from the original? How different can a child be from the parent?
Yeah, these are very good questions. So let's take a minute and talk about variants in a way that I think people will understand kind of what's going on. So variants arise when you have groups of mutations on a virus. Remember, this is an RNA virus, and RNA viruses make many mistakes when they replicate themselves. They tend to be what I call sloppy viruses. And so they make lots of mistakes. Most of those mistakes are useless and they don't do anything. But some number of mistakes, if they accumulate in the right places in the right ways, can give the virus an advantage over the previous version. Okay, so there are many variants. Most of them don't give the virus any kind of advantage. And then you basically have, essentially you think of it as like a different flavor of the same ice cream, right? It's the same thing, just a different, slightly different. Variants, actually, the variants of concern, 617, the 1617 that has arisen out of India that we call double mutant, 117 that came out of the UK, 351 out of South Africa, P1 from Brazil. There are 5 or 6 that are really becoming globally important. And they are different because basically variants can do one of 3 things. They can be more contagious, they can be more deadly, or they can evade immunity more effectively, or some combination of the 3. But those are the 3 features that you always, so whenever I see anything about, oh, there's a new variant, my first question is it more contagious? Is it more deadly? And does it evade immunity? If the answer is no to those 3, then I don't care. Who cares if it's a new variant? It's the same virus. Okay. Second is, let me be very clear, all of these variants, it's still the same virus. It still transmits in the same way. It still harms you in the same way. It isn't a new virus. It just has some new properties. So B117, the one from the UK that I think actually probably set things off in India initially. Right. In February and March, it became very widespread, especially in northern India. But even, so I think Delhi, for instance, was driven a lot of it by B117. What we know about it is much more contagious, way more contagious. It may be a little bit more deadly, but it doesn't evade the immunity at all. So immune response is the same. So therefore, your vaccines are going to work just as well. If you're previously infected, you're going to do just as well. But a little bit more deadly, a lot more contagious, which is why it spreads so much faster. 617, B1617, this is the double mutant from India. People are not calling on the Indian variant. We still are learning a lot about it. I think it has driven a lot of the spread as well. We think it arose out of India. We're still, again, there's not enough sequencing happening in India to really understand this. But here's what we know right now, and this is much more preliminary. So this may change. It doesn't seem to have a lot of immune evasion, right? So that means that the vaccines, the AstraZeneca vaccine, Covishield, should work just perfectly fine against both B117 and 617. Your vaccines are going to work.
As Covaxin.
And Covaxin, though I have not seen it tested against Covaxin in the same way. So that's why we're still learning. But certainly against Covishield, it will work just as well. Should also work against Covaxin. or Covaxin should work against this. 617, the Indian double mutant variant, it does look like it's more contagious. And that more contagiousness is probably driving a lot of the spread of this virus now. Part of the reason it's gone up so fast is because of that. That's what the preliminary evidence says. And we don't have much evidence one way or the other about whether it's more deadly. It may be more deadly. We don't know. So that's the story that we have. B117, definitely know all about it. 617, the double mutant Indian variant. These are important factors. I don't want people to think that I'm saying they're not important in driving infections. They are important factors, but this is not a magic new virus. Our vaccines still work just fine against them. And all the things that we know about how to prevent spread, mask wearing, avoiding crowds, all of that still applies.
But do you worry that more variants will now rise in India? Because India has now become a petri dish of, if I may say so, sort of RNA virus errors.
It's hard not to worry. When you have 400,000, 4 lakh cases identified every day, probably many, many more, that's a lot of infections happening every day. Every infection creates billions of more copies of the virus. That's a lot of opportunities for the virus to have more mutations and more problems. So all of us, I think, are worried about more variants in India. Of course, if that happens, the people who will suffer the most are the Indian people. But it will also become global and end up affecting everybody around the world. So the best way to prevent variants is to shut down infections, to slow down and stop all these infections.
And can India do more to find these variants or to track these?
Yes, absolutely. So one of the things that I have been struck by, India has so much capacity, so much technical ability. One thing it has not done nearly enough of is genomic sequencing. So for people who don't know, basically genomic sequencing is once you do a test, okay, you say, all right, fine, you're positive, you have the virus. Then you send that sample to a genomic sequencing machine that sequences the virus and figures out, is this a variant? Which variant is it? That's what genomic sequencing allows you to do. There are large genomic sequencing companies in the US, in China. There is not enough genomic sequencing capacity in India, but there are companies in the US who are ready to send these genomic sequencers. The reason to do this genomic sequencing is if you're not doing it, you don't know where variants are spreading. You don't see new variants arise. And you're essentially fighting a battle with no intelligence, no idea of where the virus is going to spread next, or whether you're going to have to deal with a new variant coming down the pipe. No way to fight a battle. So it is essential that India ramp up genomic sequencing. The UK does almost 10% of infections. The US does about 2 to 3% of infections get genomic sequenced. I think if India could even, India does much less than 1%. If India could even get up to kind of US standards of 2-3%, but that would mean doing genomic sequencing on 10, 15,000 samples a day. Now, India is a big country. There should be enough genomic sequencers that can do that. I think it's very, very important.
But that's not happening right now.
It's not happening.
How much do you interact with your Indian counterparts these days on a regular basis?
Some. I certainly speak to, obviously I speak to family and friends. I speak to some of the health officials who are in ministries in the States, as well as in the government of India. And then some sets of conversations with frontline physicians in Mumbai, as well as in Delhi. Mostly those conversations are just to make, so I have a sense of what it's like in the front lines for people and trying to give advice. So I would say some, but not extensive, but definitely some.
So what we'll also do is take some questions from our audience. Usually we would have done it in front of an audience and fed them some nice wine and some finger food, but unfortunately we have to do it this way. So I'll take some questions. There is S. Venkatraman who wants to know that we always knew that a second wave would come. The experts always knew that a second wave would come. But could they have anticipated that the second wave would lead to these severe problems and the need for so much more oxygen, ventilators, etc.? Can these predictions be made on the basis of data that's available?
Absolutely. Absolutely. Here's the way to think about it. Nobody knew exactly when the second wave would come. So that was not, at least I didn't know, and I don't know that that was super knowable. But by late February, it was very clear that a second wave was starting. And by middle of March, it was extremely clear that this second wave was really building force. And you could do the very simple projections and see that we were going to get to hundreds of thousands of infections every day, if not millions. And you could then do the projection to say you're going to need oxygen for, tens of thousands of people, and then quickly figure out that actually our hospitals are not capable of managing that. This would not have taken a lot of sophisticated work. And even certainly by mid to late March, many of us were very publicly saying, there is a very serious problem. India's really gonna get crushed. So, if somebody says, could you have known in early February? Maybe not. Mid to late February, maybe. By mid-March, absolutely. And that still would have given the government and policymakers plenty of time to ramp up, get ready, try to curtail the virus. They just waited until, you could see the tsunami coming for miles, and mostly it was denial that a tsunami was coming. Once it crashed on shore, that was, I think, the first time people started acknowledging, oh yeah, we have a tsunami.
Yeah. So I have a doctor now, Dr. Neeraj Pant, Lieutenant Colonel Neeraj Pant, formerly of Army Medical Corps, who's asked 3 questions, but I'll roll them into one. So he says that India has been asking for patent relaxation, etc. If all that happens, do you think India is capable of producing the cutting-edge vaccines, the cutting-edge technology vaccines, the futuristic vaccines like messenger RNA vaccines? Can India produce these? Then can India produce vector-borne vaccines like Johnson & Johnson? And do you think this might be possible in the next 3 to 4 months?
These are probably the most important questions. They're all important questions. These are incredibly important. Let me say the following. Does India have the capability? Yes. Of making mRNA vaccines, Johnson & Johnson vaccines? Absolutely. The issue, theoretically, yes, certainly has the intellectual capacity. The question is, if you relax patent rules today, will you see all of a sudden mRNA vaccines coming off the shelves in a month or 2 months? No, because to make vaccines, as you know, it's very difficult business. There's no constraint of patents for the Serum Institute, and it is struggling to ramp up more production because it has limitations on raw materials, supplies, capacity. So and mRNA vaccines are relatively hard to make, very doable for India. But the way I would think about this is what you need is, yes, you need patent relaxation, which I have been in favor of, but you also need to tie it with technology transfer. You actually need the machines that are necessary for making this. And you need to tie it with a lot of intellectual know-how. What you want to do is you want to take workers in the factories at Pfizer who are making the vaccines, send some of them to India to work with the people who are making it there to get it going, because you also want to get it right and make sure that the production is of the highest quality. All of this is doable, but it will take a lot of work. And I think this is one where you need Indian government and the US government working together. Again, you need it's not just about patents, it's about technology transfer, it's about human capital. And then of course, it's also about money. But money to me is the simplest part of this problem to solve. This is such a catastrophe that the Indian government and the American government should be willing to put up a lot of money. And I think the American government would be willing to put up a lot of money. I'm assuming the government of India too. It's not about money. It's really about that capacity to build the vaccines.
Well, India has a very good ambassador there in that circle, that's Professor Jha, because I know that you are very influential with the Biden administration on the public health side.
Well, I am trying to remind the Biden administration.
Do they get it?
Again, what's that?
Do they get it?
They do. They do. Look, it's a challenging situation because, of course, I can make the case, and I have, and I feel like they listen and they're very responsive. But part of the problem, of course, is they're also hearing it from Brazil, and they're hearing it from other places that are struggling. And so the Biden administration has to make some decisions. My strategy with them very simply is don't listen to me because I'm an Indian American. That has nothing to do with this. Remember that India is a massive country. It's a very important ally and friend. It is a major democracy, and the idea of one democracy coming to the help of another in the middle of a crisis, this is what friends do. And America and India should be friends for the long run. We have a lot of aligned interests. And so I think you do see a lot of response to that from the US government.
That's good. Now I come back to public health issue. Public health issue is Anuj Abhishek, postdoctoral fellow at University of North Carolina. That last year, when the first wave came, there was a lot of buzz that Indians and South Asians are somehow different. Recently, there was also an article from Dr. Siddharth Mukherjee, New Yorker, raising this question, that why does coronavirus hit some countries harder than others? So there was an impression that for some reason, there was an Indian exception. So there were speculations that maybe it's because of BCG, universal BCG coverage, maybe other infections, exposures to other coronaviruses. In fact, there was also a peer-reviewed CSIR paper in Current Science that said that maybe because of persistent exposure to infections, there is something. Do you think that's now completely busted, or do you think some of that is still relevant?
Yeah, I guess I would have two thoughts on this. So, I as you might imagine, I've been hearing these arguments for a whole year about how India and Indians are different. And I would say, my basic feeling is that, I'm always skeptical. Every country's population I talk to, everybody feels like they're different. Oh, sure, that happens to Americans and Europeans, but we Indians are different, or we Chinese are different, or we Japanese are different. And I always think, no, we're all actually like humans. And that probably is the single most important risk factor for this virus. I will say that theories around BCG have been around for a long time. There is a good model for why BCG could be helpful, but the data has not panned out. So actually, it's really interesting. At the end of January, I was asked to give a talk on how did India beat COVID. And I said to the organizers, I don't know that I can give that talk because I'm not sure India has beaten COVID. And they said, but it looks like India has beaten COVID. Please come tell us why we see such low cases. So I came to the talk and I had the 6 main theories. We have different populations. We have exposure to these viruses, BCG, natural herd immunity from all the asymptomatic infection. I walked through all of those theories and dismantled each one of them. And then at the end said, I don't understand why India has not had a second wave yet. I hope it never does, but none of this really stands up to scrutiny. Indians still remain very vulnerable to this virus. And unfortunately, that turned out to be right. I think a lot of us were worried this would happen. Of course, none of us hoped it would happen with the ferocity and the awfulness with which it has happened. That I think has been very surprising, but the fact that this has happened is not surprising. And I don't think that there's any major immunity from BCG or other things that really explain this.
The next question also is from a former army doctor. He's an ophthalmologist. Dr. Shailesh Kumar, Lieutenant Colonel. And if I may, I have to disclose the fact that he's my first cousin. Works in Shillong in faraway Northeast India. And his concern is about vaccines being available for children under 18. Do you think these are safe for children under 18? And when do you think will there be a more universal rollout and acceptance of these vaccines for the under 18 population?
Yeah, I do think, again, we have to test them in kids under 18. We have tested some of these vaccines in kids under 18 and they look quite safe. So my sense is that they will be safe, but kids should get vaccinated after adults have gotten vaccinated, and particularly older adults and high-risk adults. So my sense is that India is probably not going to be vaccinating kids for many, many months because it has all the elderly people, all the other high-risk adults to vaccinate. I would really just go down the road. And so start with elderly, high-risk, younger adults, and then I would get to kids. So I would not worry about vaccinating kids in the short run until other people are vulnerable. And it just depends on how quickly India can produce and get more vaccines, whether it's going to be 3 months or 6 months before we can start seeing kids get vaccinated.
I'm surprised, pleasantly surprised by the number of questions we've got from doctors. There is a lot of curiosity because, otherwise the only doctor you worry about is the one who thinks that I know everything. I have to ask nothing.
Correct.
Because I got experience. Rahul D. Modi, Assistant Professor and Clinical Lead, Gynecological Cancer Services, Cancer Research Institute, Dehradun, who wants to know what's your take on repurposed drugs like, let me get the pronunciation right, fluvoxamine, bevacizumab, tofacitinib in COVID treatment. Certain studies do show benefits of these drugs in addition to steroids in the cytokine storm phase. Results are almost similar or better than tocilizumab.
Yeah, these are really good questions. And the answer is, like, when I think about fluvoxamine, for instance, he's absolutely right. There's at least a couple of studies, one study I can think of off the top of my head that's promising. I wish we had more data. I think if you are gonna give anything, that there may be more evidence to do that. I think certainly, let me take the other things like hydroxychloroquine, ivermectin. I would not go down those roads because, again, those have proven to be ineffective. What you're describing is things for which there is some evidence. It's not super strong yet. And using them clinically is a bit more reasonable, but of course you have to closely monitor to make sure that people are doing okay. You really are going off of the standard WHO protocol, but in an emergency that makes some sense. But you do want to be careful about how you use
because there is a scientific logic there that these are anti-inflammatory.
Yes.
These calm down your immune system.
There's a scientific logic and there is some evidence. So this is not unreasonable. We do this in medicine in crises where you don't have a good therapy, but there's a good scientific basis and some evidence. We do often make prescriptions for those kinds of therapies.
Now, somebody who wants to take you back to the region of concern in India, that is UP, Bihar, the Hindi heartland of India, where you come from also.
Yeah.
Where do you come from in Bihar?
Where? So my family is in Madhubani, which is, near Darbhanga and not there.
So that's a Mithila region, isn't it?
It's the Mithila region. I grew up speaking Maithili, which of course now I can't
speak
any.
Kautilya's Mithila region, right?
Yes.
So Bhaskar Sharma is a consultant in independent food consultants for food factories. He says that virus is now spreading to UP, Bengal, Bihar, and rural hinterland of other poorer states. Do you think there is anything like a natural burnout of the virus? And if so, how long will that take?
Yeah, natural burnout of a virus.
That it burn in the process is a different issue.
Yeah, the problem of a natural burnout is it has to infect so many people before it burns out that you're going to have many, many, many black people, many hundreds of thousands, millions of people dying. So we have not seen any country which has reached kind of a natural herd immunity by burning its way through the population. And you would have to, as I said, you would have to end up infecting a vast majority. We think probably 80% of the population would need to be immune before this virus really burns itself out. That's 1 billion people, right? That's an astronomical number of people. So that's been the experience. I mean, there's no country that has tried that strategy. Countries that like the UK or even the US at times thought maybe they would try to do that. Off all of us basically said that's a terrible idea. The key, there is only one way out of this virus. Keep it under control, use public health measures, and get as much vaccines as possible and vaccinate as many people as possible.
As we come to the conclusion of this, I will ask you a question. So I'm leaking the paper to you, so to say. I will ask you to describe public health and why that is so poorly understood in most countries. But we'll keep that towards the end. Now, Sudipta Roy, who's group head of unsecured assets at ICICI Bank, she's asked a question, most of which we have answered, about the new variants. But she wants to know particularly that what do you make of the fact that this AstraZeneca vaccine does not seem to work against the South African variant? Is that
Yeah, that is the evidence. She's absolutely right that the South African variant 351, B1351, does seem to evade AstraZeneca vaccine. It's not great. Uh, Again, it's the only vaccine we have seen and the only variant we've seen where there really does seem to be an escape. It is because of the way the AstraZeneca vaccine has been constructed. This does create some challenges. Now, here's the good news. I don't think 351, the South African variant, is a particularly contagious variant. So that means I don't think it's going to be able to outcompete. Remember, when it shows up in India, it has to outcompete 617, the Indian variant, and 117, the UK variant, in order to really take hold. I don't think it's going to be able to outcompete those other two. So I don't expect.
It's got competition.
It's got competition against the other viruses. So I don't think it'll end up taking hold in a major way. And as long as we can keep virus levels, kind of keep people getting vaccinated and stopping the spread of the disease, I don't think 351 will end up being a major problem. But if it does, then there may need to be changes to the AstraZeneca vaccine or using one of the other vaccines. I have not seen the data on Covaxin and 351. We don't know if it works any better or not, but it is a bit of a problem. We all have to keep our eye on it. I don't think it'll end up being such a problem that it will somehow create another wave of infections, for instance.
In fact, if I may just mention it to you incidentally, that South Africa is another place where ivermectin is very popular. Looks like everybody is popping ivermectin there and feeling safe.
I wish it worked. I wish it worked. It would be great if it did.
Well, if nothing else, at least in areas which have poor water hygiene, it will sort out a lot of the parasitic problem from people's guts. So
I suppose that's helpful. Yes.
It has some benefits, yes. I know that a lot of people in our audience will wonder what we're talking about, but ivermectin is a drug which is usually given as an anti-parasitic. Exactly. So we have worms in our bodies, which this drug for decades has been used to kill. Padam Agarwal wants to know ask a simple question. Do you think India would have handled the second wave better if India had its own Dr. Fauci?
I think it is very important for countries to have independent medical public health voices. That has been what Tony Fauci has been for 25, 30 years in the United States, is that whenever there's been a health crisis, he has spoken up, no matter who the president. And it is always important to have independent voices speaking up for the health of the people.
Yeah. And also, he had to have that formidable reputation and also public opinion to ride out the Trump phase.
Absolutely. Absolutely.
I don't think the world has seen a leader more anti-science than Trump.
Yeah, I agree with that.
Although for some reason, it still paid money to vaccine manufacturers to at least warp speed happened.
That was one of Trump's biggest successes. And I'm thankful. I am thankful.
Because at least, a lot of people had half an expectation that he will say, what vaccines? This will just wash through us, the Chinese virus.
Exactly.
Yeah. And how did the Chinese get it right, you think?
Well, they also went early, then they went to technologies that they had a lot of experience with. So the Chinese vaccines are using older technology, but they also started very, very early and made a big bet that they were going to have to make vaccines because they saw it firsthand how devastating this disease can be.
Yeah.
And they saw how much work it takes to control it. So they knew that they needed to make vaccines for the whole Chinese population.
Do you trust the Chinese data, Chinese numbers?
Yeah, there's a lot of questions about that. I don't not trust it. I don't have any reasons to think that the numbers are fake or false. I just wish there was more openness and transparency. I haven't seen the full set of data in a way that I have for Johnson & Johnson and Moderna and Pfizer and AstraZeneca. So I just want more information about the Chinese vaccines, but I don't have any distrust of it.
But distrust about China's infection numbers?
Oh, I'm talking about the vaccine. The distrust, I have a lot of friends and colleagues in China. I think it's hard to tell what's happening with infection numbers, but I don't think they are having massive waves and tens of thousands of people are dying and they're hiding. There may be some underreporting. There probably was from the original outbreak in Wuhan, There clearly was. But I don't think there's some massive suppression of numbers coming out of China.
I'll take the last question from our science editor, Sandhya Ramesh, who says, what do we now understand about how herd immunity works? It is a reasonable objective to chase after. Will it be feasible to achieve through vaccination if antibodies only last 3 to 6 months?
I don't think antibodies only last 3 to 6 months, by the way. I think they're going to last a bit longer than that. From a natural infection, they probably last more like 6 to 12 months. But antibodies, or more important, immunity from vaccines, I suspect may last years. And therefore, vaccines are the way out of this. Vaccines are what we're going to get us to herd immunity. Vaccines are what's going to put this infection behind us. Even if we don't get quite all the way up to herd immunity, if we can get a high level of proportion of people vaccinated, it will bring infection numbers way down to very, very manageable numbers. And it will allow us to kind of go back to life. So it's all about vaccinations in the medium to long run. That's how we end this. And all the data so far suggests that these vaccines produce immunity that lasts, in my mind, at least a year, probably multiple years. But we don't know that for sure. We're going to have to learn that. But I think it's going to be quite durable.
It's a fascinating conversation. It can go on. I have oodles of time, but you have more stuff to do. So I will come to the question that I leaked to you earlier. That what is public health and why it is, one, so poorly understood, and why is it not given sufficient importance? Because I find that even in medical colleges, you go to public health if you fail to get cardiology and pediatrics and et cetera, et cetera.
Yeah, so public health is interesting. So I went into public health as a physician because one of the things that was very clear to me as a doctor taking care of patients was so much was happening around their lives that was shaping what happened to them in their health that I was not aware of. And all I could do is see what was in front of me. So public health looks, people often say a doctor looks at one patient at a time. Public health looks at a population at a time and looks at the whole broad context. So public health person looks at India and sees all of the things, the factors that shape health for people of India. Not just if you get sick, do you get the right treatment? That's one part. But we all know that everything from water and air to your environment to all these other factors drive what happens. And then, of course, public health is deeply interested in population level phenomenon like infectious disease outbreaks, because infections are inherently not an individual person thing. It spreads through society. And that's where public health tools like epidemiology, biostatistics, behavioral issues really come into play. Public health, no one pays attention when everything is going well. I always say, if you don't know the outbreak, if your water is clean, if your air is reasonably good to breathe in, there's no large outbreak happening, you don't notice public health working. It's only when those things happen that everybody goes, oh yeah, public health, we have to think about the whole collective. And it's a reminder that we're all connected together, that what one person does ends up influencing the health of other people.
Although in the field of medicine, I think you guys make the least money.
Shekhar, what can I tell you about that?
So before I let you go, two things. One, I want you to speak to Indian doctors or Indian medical community for what they are facing and what they are doing, a message for them. And after that, I will also request you to speak to the people of the heartland in their language, to your best ability, which I know is not bad, because, there seems to be a feeling, this is coronavirus is a conspiracy. For example, our reporters went to meet these farmers who are protesting, and they said, this is Modi's conspiracy to break protest. So there is a lot of that stuff, and people want to listen to real experts in their language. So first of all, your message to Indian doctors, medical community.
Yeah, my message to my fellow physicians in India is really that you are at the front lines of the biggest health crisis that India has faced in a century. And your work is very, very difficult right now. But your job, because this is the profession we all signed up for, is in a moment of crisis to use evidence and science and data to do things for people that only we can do as physicians. And, society doesn't always reward you for this. Not everybody acknowledges it. When bad things happen, you face a lot of negative consequences. But this is what motivated me, and I suspect motivated almost everybody who's listening to this, to become a doctor, to take care of people, to provide care when people are sick. And there's a unique opportunity right now, very difficult moment. But I think the nation will be very thankful for the work you are doing. So I want to say thank you to the doctors of India who are facing extremely difficult circumstances and doing extraordinary work.
That's a wonderful message. And now speak to people back home.
Yeah, my Hindi, मेरा हिंदी जो है,
in terms of what they are facing and what they should be doing.
अभी बहुत मुश्किल समय है. कोरोना वायरस जो है फैल रहा है इंडिया में, देश में. लेकिन अगर अपने अब मास्क पहनना भी बहुत इम्पोर्टेंट है, बहुत जरूरी है. लोग दूसरे लोग के साथ कम मिलना, बाहर में अगर मिलना है लोग सबसे ज्यादा बाहर में मिलना. अगर तबीयत खराब हो जाए तो उसका जाके टेस्टिंग करा के, इलाज करा के दिखलाइए कि क्या हो रहा है. लेकिन ये बहुत सीरियस बीमारी है. ये कोई छोटा मोटा चीज नहीं है. ये बहुत सीरियस बीमारी है और उसको हम लोग को मैनेज करना पड़ेगा. लेकिन हम कॉन्फिडेंट हैं, हमको मालूम है कि हम लोग इंडिया में हम इसको मैनेज कर सकते हैं और उसके बाद कोरोना वायरस को हम लोग हरा सकते हैं. और जब एक बार सबको को वैक्सीन मिल जाएगा तब हम लोग अपना जो लाइफ है उसको, जो हम लोग जिस तरह से जीते थे, वो फिर पॉसिबल हो जाएगा. लेकिन अभी बहुत मुश्किल समय है सबके लिए, इंडिया के लिए, लेकिन कोरोना वायरस को हराना है.
टीके से डरे या ना डरे?
कौन चीज करें कि नहीं करें?
टीके से डरे या ना डरे?
डरना से, देखिए डरने से कुछ नहीं होता है. जो वायरस है उसको मैनेज करना है, उसको संभालना है और जो उसको हराना है, और किया जा सकता है. इंडिया में हम लोग को, भारत में हम लोग को नॉलेज है, मालूम है कैसे किया जा सकता है और उसी पर भी फोकस करना है.
Should they be afraid of the?
नहीं, वैक्सीन जो है उस बहुत इंपॉर्टेंट है कि सबको, अगर आपको अपॉर्चुनिटी मिले, टाइम मिले, अगर चांस मिले वैक्सीन लेने का तो लेना बहुत इंपॉर्टेंट है. हम वैक्सीन लिए हैं, मेरा पूरा फैमिली को वैक्सीन मिला है. मेरा फैमिली जो इंडिया में है, बिहार में है, उन लोग को हम सब कोई बोले हैं, अपने भाई बहन, अपनी पीसी, मामा मामी, सबको को हम बोल रहे हैं कि जाके वैक्सीन लीजिए जब आपको अपॉर्चुनिटी मिले. बहुत इंपॉर्टेंट है कि सबको वैक्सीन.
बहुत बहुत अच्छा संदेश है आपसे, आपके घर, आपके देशवासियों के लिए. और बहुत बहुत धन्यवाद. थैंक यू वेरी मच. Keep making sense and keep spreading more sanity and more science, because I'm not pessimistic about these things, although our family has suffered greatly in this process. Because if anything will pull us out of this, it's science. Nothing else will pull us out of this. So
science is the knowledge base, and then humanity is that putting that science into action. And we can do those things and get beyond.
Absolutely. So thank you very much. I think this has added a great deal to our knowledge, and I look forward to doing this again. And stay healthy and stay well. And I hope your family in Bihar is in good shape as well.
Yes. Thank you, Shekhar. It was a pleasure talking to you. Take good care and be well.
Thank you, Professor Jha.
Bye-bye.
The Print off the Cuff, presented by IIFL Wealth and Asset Management, powered by K Rahija Corp, corporate partner, AU Small Finance Bank, in association with global insurance brokers, airline partner SpiceJet,